Hi, I'm Susan Eddington, and I want to talk to you about challenges and opportunities for health information in the face of information pollution. COVID-19, considered a 100-year pandemic, was the first such health disaster in the digital era. The extent of information pollution, including lies, misrepresentations, conspiracy theories, and other attempts to mislead and confuse the public, created a previously unknown health communications crisis. As the Director General of the World Health Organization said at the time, we're not just fighting an epidemic, we're fighting an infodemic. Fake news spreads faster and more easily than this virus, and it's just as dangerous. So what is an infodemic? It's a blend of two words, information and pandemic. WHO explains that infodemics are an excessive amount of information about a problem, which makes it difficult to identify a solution. They can spread misinformation, disinformation, and rumors during a health emergency. Infodemics can hamper an effective public health response and create confusion and distrust among people. So what is information disorder? It includes misinformation, which is sharing information that is not factual, but one believes to be true. Disinformation, deliberately spreading information that is known to be false. Or malinformation, reconfiguring factual information with an intent to cause harm, or sharing facts with an intent to cause harm. So when we look at the rise of information pollution, we go to the U.S. presidential campaign of 2016, when 20 top-performing false election stories from hoax sites and hyper-partisan blogs generated 8,711,000 shares, reactions, and comments on Facebook. Within the same time period, the 20 best performing election stories from 19 major news websites generated a total of 7,367,000 reactions, comments, and shares on Facebook. 10.1% of traffic to the top news sites came from social media, compared with 41.8% from misinformation, disinformation, and malinformation sites. So how does it spread? Content that contains misinformation tends to get more engagement, meaning likes, views, comments, and shares, than factually accurate information. The growing disregard for facts, data, and analysis in political discourse and civil discourse in the United States led to what the RAND Corporation has described as truth decay. The organization cited particular concern for its observations that policy decisions that can affect American democracy are being made primarily based on opinion or anecdote rather than objective facts. As John F. Kennedy stated, they follow the Hitler line. No matter how big the lie, repeat it often enough, and the masses will regard it as the truth. So how do we define truth decay? It's an increasing disagreement about facts and analytical interpretations of facts and data. It's a blurring of the line between opinion and fact. It's an increase in the relative volume and resulting influence of opinion and personal experience over fact. And it's lower trust in formally respected sources of factual information. We have a lack of confidence and a question of credibility. Americans have a lack of trust in media. Most Americans expect to see bias in their preferred news source, whether it is a great deal or a fair amount of political bias in reporting, suggesting news outlets are failing to perform their roles as the source of news and information that holds leaders accountable for their actions and protecting the democracy. Americans acknowledge there is bias in the news they receive. However, they're more concerned about the bias others receive from their preferred media sources. This lack of trust stems from the belief that reporters are misrepresenting the facts or fabricating information. Americans have a lack of trust in institutions. Many Americans lack confidence in major U.S. institutions, including business, religion, the U.S. court system, and schools, all of which in 2022 were found to be at the lowest level on record in the nation's history. Democrats and independents had more than a double-digit loss of confidence in the Supreme Court. Independents were found to be significantly less confident in organized religion than when they were previewed previously, and with a drop among Republicans, but not any change among Democrats. So what are the consequences? 4 studies looked at the proportion of health misinformation on social media and found that it had reached up to 51% in posts associated with vaccines, up to 28.8% in posts associated with COVID-19, and up to 60% in posts related to pandemics. Among YouTube videos about emerging infectious diseases, 20 to 30% were found to contain inaccurate or misleading information. Promoting and disseminating trustworthy health information is crucial for governments, health authorities, researchers, and clinicians to outweigh false or misleading health information disseminated in social media. The authors concluded social media channels can also be used to counter false or misleading information, but that further studies may be required to evaluate the best format for such outreach and to determine which channels work best for different populations, geographical settings, and cultural context. How do you know what's real? The goal of disinformation is to confuse and manipulate the public, distract, divide, and demoralize communities, and control a narrative, all for financial, political, or ideological gain. So, the questions you should ask: is it difficult to separate facts from opinions? Does it fail to cite experts from reputable organizations? Is the original source of the information hard to pin down? Does it confirm your beliefs or play to your emotions? Does the group, person, or organization sharing the information have a stake in the claim, financial, political, or otherwise? Does it require belief in a secret plot and a group of co-conspirators? Does it scapegoat people or groups? Is it spread by someone who recently started their social media account but has a lot of followers? You should always consider the source. If it's a news article, video, or social media post, ask these questions. Does it identify original sources of factual content? Does it link to independent experts with relevant knowledge and/or to peer-reviewed science? Does it make it easy to identify funding sources or ideological or policy decisions? Is it produced by an individual or organization that has an established position on the topic? Does it present diverse points of view fairly while acknowledging the importance of expertise? Does it treat individuals who have diverse perspectives with respect? Does it distinguish facts from opinions? Does it back up its statements with evidence? Are other news sources presenting the information similarly? Is the content free from racial, gendered, or otherwise problematic stereotypes? Is the information consistent with what scientists and other experts are saying? If the source is a study or a report, ask these questions. Are the authors experts on the subject? Is the study peer-reviewed? Have the authors disclosed their conflicts of interest and funding sources? If yes, does the sponsor have a vested interest in the outcome of the study? Does the publisher have a pre-existing policy or ideological position on the topic? Is the tone objective? Does it describe potential positives and negatives in fair terms? Does it cite and critique conflicting findings? If other scientists have commented about the study, are they raising major concerns about how the study was conducted? In summary, there are certain things that we all have to do to make a difference. Diligence, critical thinking, and aggressive application of technology and media literacy will help this ongoing battle for hearts and minds. We all have a lot of work to do. Thank you for this opportunity.